Mark Butler, welcome to the program. Now, you've been highly critical of the government for not securing more vaccine options, namely Moderna and Johnson & Johnson. The Scientific and Technical Advisory Group, which advises the government on this, it's chaired by Professor Brendan Murphy. It includes Professor Paul Kelly, Professor Alan Cheng and so on. They have not recommended any of these supply agreements with these other drug companies. Are you suggesting they've got it wrong?
Well, we didn't pluck the idea out of thin air. A range of experts in Australia were saying that best practice was to have more than 4 deals, 5, 6 deals. The UK has 7 deals on the table to ensure redundancy in our system, to ensure that there was a backup when something like the AstraZeneca advice arose. So the UK, for example, is also dealing with the fact that they're not going to be giving AstraZeneca to young people, but they've been able to substitute the Moderna vaccine, a highly effective, state-of-the-art mRNA vaccine, and will soon be substituting the Johnson & Johnson vaccine as well. So what we were saying well back into last year was not based simply on our thoughts, it was based on very clear expert advice that best practice was to have 5 or 6 deals on the table to ensure there were backups in the system when something unforeseen like this arose.
So just to be clear on that, though, you're saying there are other experts who you are listening to on this. You think those experts on the Scientific and Technical Advisory Group have not got it right?
Well, we think that the safest thing to do would be to have more deals on the table, not less. 5 or 6 was seen as best practice around the world. You just have to really reflect on the experience we've had over the last couple of days. We are now in a very difficult situation. Australia was already way behind schedule in our vaccine rollout, not in the top 100 nations in the world, and a bad situation has been made far, far worse by these unforeseen events around the AstraZeneca vaccine.
Well, Professor Murphy says on this, they decided to go with Pfizer instead of Moderna because, quote, of its capacity to deliver. It's not a new company. He says if we'd gone with Moderna, it's not clear we would have had much delivered by now anyway.
Well, I don't think anyone's ever suggested we should have gone with Moderna instead of Pfizer. What you see through North America, in the UK and through Europe is countries using both, plus other vaccines as well. Moderna, for example, will be delivering 20 million vaccines to the UK, which allows them to substitute those vaccines, highly effective, state-of-the-art vaccines, for the AstraZeneca, which is being paused for young people. So we just think a vaster portfolio, and I've been saying this consistently since I became the Shadow Health Minister, a vaster portfolio builds redundancy into the situation so that when these unforeseen events arise, you're able to maintain what momentum at least we had in the vaccine rollout strategy.
And on Johnson & Johnson, again, Professor Murphy says there might have been similar issues to AstraZeneca, and indeed overnight the European Medicines Agency has announced it's reviewing the Johnson & Johnson vaccine after some blood clot cases. So is it clear that would have been a good option?
Well, as many options as possible should have been on the table. I've seen that advice from the European Authority that they're also investigating a possible relationship between the Johnson & Johnson vaccine and clotting. And again, that just reinforces the argument to have more options on the table, not less.
Have you spoken to Brendan Murphy about these concerns, and what does he say to you?
Well, I have briefings from time to time with the Chief Medical Officer and the Secretary of the Department. I don't go into those private discussions, but I've raised with them what I've raised publicly and what Chris Bowen before me was raising publicly well into last year. And that is, what negotiations is the government having with other companies like Moderna, like Johnson & Johnson, to ensure that going forward we have as many options on the table as possible. The other point I've been making is that against the Prime Minister's advice that this is somehow not a race, we think there is a time imperative here. It's important that we get the current generation of vaccines into people's arms so that we're ready for potential booster shots as early as later this year to deal with the variants or the mutations that are spreading all around the world. I mean, Matt Hancock, the UK Health Secretary, is preparing for variants to be dealt with through booster shots later this year. We won't even be through the first generation of vaccines when other countries are looking at boosters.
Well, let me talk about what to do now with the AstraZeneca vaccine in particular. The recommendation is that Pfizer be preferred for those under the age of 50. I'm just wondering if you think that's clear enough, because some GPs are now worried about their legal liability if they do give AstraZeneca to under 50s. It's not banned. It seems to be up to the doctor's advice. Is that clear enough, or do you think it should just be you cannot have it if you're under 50, you can only have it if you're over 50?
Well, I watched the Prime Minister's press conference the other night, and I thought the sort of freelancing comments he made towards the end of that were raising very difficult decisions for GPs and patients. And we've seen on the front pages of papers this morning the AMA suggesting that there are potential legal liability concerns for GPs in potentially giving the AstraZeneca vaccine to under 50s. When the point the Chief Medical Officer has made is that there is no identifiable characteristic that would predispose someone under 50 to these potential clotting events. So it raises the question, what is the discussion between a GP and their patient about the sorts of circumstances that would lead them to agree to take the AstraZeneca vaccine? And in the event of there being one of these adverse clotting events, what is the potential liability of GPs? So I think that this is something that does require further advice from our public health experts, by the chief medical officers and the Department of Health, to ensure that GPs are able to have these discussions with their patients with confidence.
So, I mean, just to clear that up, should it be clarified? I know some states, WA, is only now providing AstraZeneca for over 50s. Should it be that clear that you can't have it if you're under 50, or is this a question of ensuring that legal liability issue is sorted out?
Well, it's not really a matter for me, and frankly it shouldn't be a matter for the Prime Minister either. It should be a matter for good public health advice from our public health experts, and I think probably what needs to happen is some further discussions between those experts and the representatives of our GPs, because, you know, I think what we've seen over the last couple of weeks is GPs really left in the lurch by the government making decisions on the run. We saw that when Greg Hunt announced, without telling GPs, that millions of patients should get on the phone the next morning and ring their GPs to make appointments. And all of this has really led, over the course of the week, in a range of GPs suggesting they may actually pull out of the scheme because of all of this confusion.
Can I ask you about some of the other criticisms you've been making in recent weeks? You've said, and I quote, there are hundreds and hundreds of thousands of doses that have been in the country for quite some time, sitting in storage. Again, Brendan Murphy's completely rejected that. What are you basing that on?
Well, I'm basing it on advice that we had around 1.3 or 1.4 million doses received from overseas, that there were around 1 million doses of AstraZeneca made here in CSL that had been approved, batch approved by the TGA. So my math says about 2.4 million doses. We only just clicked over 1 million doses given to Australian patients in the last day or two. You know, compare that, for example, to 750
they're either doses that are waiting for batch testing, or are being delivered, or are being administered. There's none sitting in storage, as you put it.
Well, OK, if they're not in storage, they're in trucks, they're not being put into people's arms. I mean, we've had hundreds of thousands of these doses in the country for some time now, and yet this rollout is still proceeding at a glacial pace. You know, we only clicked over 1 million in the middle of April, when the Prime Minister said we'd have 4 million doses by the end of the month. The US is putting 4 million doses into people's arms every single day. They're at 175 million right now. We're at 1 million. The UK is at 38 million. We're at 1 million. 750 million around the world. We're at 1 million. I'm making the point, this needs to happen quicker. It needs to happen more effectively, because the strength of our economic recovery is inextricably linked to the speed and effectiveness of this vaccine rollout. This is a race, both in health terms and in economic terms.
Should the Commonwealth hand over more responsibility to the states here, and should they go with more mass vaccination hubs?
Well, I've made the point a number of times that I think the states are best placed to do this sort of mass health service delivery. That is what they do. The Commonwealth doesn't have a history of that. You know, the Commonwealth is good at policy making, they're good at financing arrangements. It is the state governments that have the capability and the experience in delivering these sorts of mass health service deliveries. And I certainly, if I was in their position, would have involved the states far more than they have.
And Mark Butler, just a final question. The government is now reworking the timetable for the vaccine rollout. Clearly the October deadline's gone. Given what we know, what do you think would be a reasonable time frame in which to have the vaccine or a vaccine offered to the entire adult population?
Well, that really is going to remain to be seen, depending on what the government rolls out. I think they are going to have to involve the states more. We really can't have a situation where vaccines are rolling out into next year, which seems to be the Prime Minister's thinking. He's refused to guarantee that people would even receive first doses by the end of Christmas. Absolutely. I mean, all around the world now, countries are preparing for the possibility of booster shots to deal with these variants later this year. Moderna has sent their booster shots for trials in the US. As I said, the UK government is preparing for booster shots later this year. And this is not just a question of the strength of our economic recovery, it's also a question about the health of our population.
Mark Butler, thanks so much for joining us.
My pleasure, David.